with Paragon Wealth Management here in Walnut Creek. I've been a wealth advisor now for over 20 years. I still can't believe that. But I'm also local, born and raised in Castro Valley, live in San Ramon. My kids went through the San Ramon schools and now they're adults. So, and cancer, in supporting cancer groups like, Cancer Support Community is important to me. My mother had breast cancer and colon cancer. I lost a sister to breast cancer. So this is one of those things that I really want to support because it truly has affected my family, as I know everybody on here it's affected. So that's why I'm here. Eric.
Hi, everybody. My name is Eric Flett, and I'm a financial advisor in Lafayette when my firm is called Concentric Wealth Management. And Mary and I are members of the Financial Planning Association here in the East Bay, and we have several hundred financial advisors, but the FPA East Bay is a great partner with the cancer support community, and I've also had cancer touch my life as well. And so Mary is by far the expert on this subject. I'm here to back her up. And at the end, we'll have time for questions, and we also have some email addresses if you need to follow up with us. But happy to be here, and thank you all for joining us.
And Mary,
Thanks, Eric. I was just going to thank you, Eric, for remembering to mention FPA. I as soon as I said your name, I thought I didn't mention FPA, but you picked up that ball. Go ahead, Libby.
So just a housekeeping, when you're presenting, do you prefer for everyone to hold questions until the end or ask them sporadically in the chat?
I'm okay with questions as long as we still have, enough time to get through the presentation, which I'm really sure we will. Eric, are you okay with that?
Sure.
Okay.
Okay.
So let me go ahead and share my screen. Can everybody see my screen now?
Yep.
Yes.
Perfect. So again, as Libby said, we're going to be talking about medical insurance today and hopefully answer questions that you have about your medical insurance. We won't have all the answers, but if we don't have the answers, we can probably find out an answer for you and get back to you. So we'll go ahead. I guess I'm going to have to run the slides here too. So the first question is, what is medical insurance? Why is medical insurance important? Well, we want medical insurance for the financial protection. It helps us cover the costs of any treatments, any sort of medical treatments. It gives us access to quality care. In a lot of ways, we get to kind of choose who's taking care of us when we do have medical needs. People who actually have insurance, medical insurance, are more prone to take better care of themselves health-wise and actually go and see doctors, and so that they can get early diagnosis of certain medical conditions. And so also having medical insurance does give people peace of mind. I'm sure somebody on this call knows somebody who hasn't had medical insurance at one time or another, and that can be a very, very stressful situation, especially if somebody gets sick. So our hope today is that by the end of this presentation, you'll understand the basics as it pertains to medical insurance. You'll understand the different types of medical insurance that exist out there. We're going to go over basic terminology with you, and we're going to help you kind of navigate some of the common challenges. Okay, so good. So good so far. Get that out of my mouth.
Good so far, Mary.
Good. Does anybody have any initial questions that they've been just sitting on all day today, waiting for this presentation, that you want to make sure you get it out there and ask? And I may not cover it right now, but at least I can write it down and make sure I hit on it. Any? All right. So basics of medical insurance. It's really simple, truly. It's just an agreement between you and a health insurance company. You pay a premium in exchange, they help pay a portion of the cost of your medical bills. Okay, that sounds pretty simple, but it's not. There's a lot of details, and as they say, the devil is in the details. So here are the different types of medical insurances that exist out there. There's what's called a health maintenance organization, or an HMO. First one that always comes to mind for me is Kaiser. Kaiser is a fairly well-known HMO here in the Bay Area. And then there is a PPO, which is a preferred provider organization. Medicare for anybody who's over the age of 65. And then for people that have low income, they might be using Medi-Cal. Did somebody want to say something? Okay, moving on. So a health maintenance organization they have a specific approved list of providers and facilities and hospitals that their insurees have a list of who they can choose from. Normally, because they have such a select list of doctors and facilities, they are able to negotiate prices so that the insurance premiums are lower than PPOs, but they're not necessarily as flexible as PPOs. Patients who have HMOs will be assigned a primary care physician, or a PCP is the acronym that's used. And that PCP, primary care physician, is going to be the one who like quarterbacks all of your care. And they're the ones who decide what specialists you get to see. HMOs do usually have fewer deductibles and lower deductibles than some of the other PPO plans. But the one big thing about HMOs is they will not cover doctors and facilities that are not part of their HMO organization unless you're outside of an HMO area and it's an extreme emergency. Questions about that? No? Okay. Eric, did you want to take this one?
Sure. A PPO, preferred provider organization, is a medical care plan where the doctors and medical facilities provide services to subscribed patients at reduced rates, but the preferred providers are approved by the plan. And the key, though, is that you get to choose who you want to use. Some are in network, some are out of network, but you will have a primary care physician, but you still have the opportunity to make the decision of who you want to work with. So PPO patients have a little higher deductible, and they tend to be more flexible than the HMOs. And I guess one of the questions, I know before we go on, is there anybody who's unclear? Stop us if are you unclear whether you have a HMO or a PPO, or I just want to make sure you kind of know where you are at this point. Yeah,
There are some comments on the chat.
I saw
Not
that
about that, but I guess
appeals.
other things.
Yep, we're going to talk about appeals and meeting the deductibles in a few minutes. So thanks for sending those questions in. Mary, did you want to take the Medicare part? Angela, did you have a question?
Yeah, I don't, I switched over, my insurance changed in January, and I'm not sure if I know I don't have Kaiser, but I am not sure if I have an HMO or a PPO. How do I tell the difference?
What company are you with?
United Healthcare?
Okay.
It might be either with United Healthcare. Do you have a medical card?
Yes.
Okay.
Does it say on your medical card?
Well, I don't have it right here in front of me, but I'll
Yeah,
let you go ahead with the presentation. I'll run and go get it.
Okay.
That would be the first place I would look, because
Okay.
a lot of times they will say right on there.
Okay, thanks. I'm gonna go get that. I'll be back. Go ahead though.
Sure. So Eric, you want me to take?
I want you to take the Medicare
Okay.
stuff. Yep.
Okay. So most people here in the United States are familiar with Medicare. Medicare is the government medical program that was put in place to be able to protect our older citizens, especially those that have been working all their life. So once somebody attains the age of 65, they can go on to a Medicare plan. And sometimes, under certain circumstances, if you're under 65, you can also qualify for Medicare, but it would be if you are disabled and not able to work in any capacity any longer. And there are two different types of Medicare out there, and it's really important to understand how Medicare works. There's the original Medicare program, which is the government system. And then there's supplemental Medicare, which is actually run by insurance companies, and it's not the actual government program. So that's really important to understand that there is a difference, because a lot of people don't realize once you pick a road, there's like a Y in the road. And once you pick one lane or the other, that's the lane you're going to stick with. Okay. So let's talk about the different types of Medicare. You may be aware that there are different parts in there. It's their alphabet soup. So Part A is the part that we pay for the whole time we're working. There's payroll deductions that are done for Part A. And what Part A covers is hospitalization, skilled nursing care, some hospice, some home health cares. There are some limitations that come into play. There are no additional premiums to be paid with Part A once you go on to Medicare. But then we bring in Part B. Part B is paid, and there is a premium, and the premium you pay is based on your income level. And if one is on Social Security, it will be deducted from your Social Security, along with Part D, and as in David, which is the drug plan or prescription drug use part of the original Medicare. So your Part B, again, is for your doctors and other healthcare providers. It's any outpatient care. It has some home health care coverage in it as well. Also, anytime you need some durable medical equipment like wheelchairs and walkers and beds and so on and so forth, that's where Part B comes in. It also pays for your preventative services, and there will be no additional charge for additional services as long as you've been paying your Part B premiums. And again, Part B premiums are pretty straightforward because for the most part, it's going to be deducted from your Social Security check. Now, since Medicare starts at 65 and the age of full retirement age for Social Security keeps creeping up, some people do have to pay their Part B out of pocket for a couple of years. And there is a way to do that through auto deductions from your checking account. Again, Part D is available for any sort of prescription drugs that you're being prescribed and need to take. There are deductibles. There's what's called the donut hole with Part D, but that is the part of Medicare that handles all of your prescription drug use. Then there's what's called the supplemental coverage Medigap. This is still part of original Medicare, and it is a supplemental plan is what covers everything that the rest of these don't. Okay, it's part of how you get coverage for that donut hole in the middle of your Part D. So a lot of people will actually pull a Medigap plan to supplement their original Medicare. I know it sounds really complicated, and honestly, it can be very complicated, Medicare. I don't know why our government can't do anything without making it complicated. So now let's talk about the other side of that V in the road that I was talking about, and that's the Medicare Advantage. That's Medicare Advantage is what you see advertisements for on the television all the time. And but one thing that people need to understand is it's not original Medicare. It is an alternative to Medicare, and it is run by insurance companies, okay, and not the federal government. As I said here, it's the original Medicare is a governmental program. Medicare Advantage plans are bundled plans. They include all of the alphabet soup in them. They'll have hospitalization, which is like the Part A. They'll have doctor's visits, like Part B. They will have drug coverage, like we see with Part D. But they also will advertise that they have other things like vision and dental. They also will say that their premiums are lower, but you need to really monitor the fine print when you're getting into a Medicare Advantage plan, because a lot of times the deductibles are higher and the out of pocket is higher. So again, back to that slide earlier on, the devil's come into the details, and you really want to make sure you know what you're getting. One Medicare Advantage plan that I think works really well, if you've been on Kaiser your entire life, going on to Kaiser's Senior Advantage plan is a very easy way for people who already know how to navigate the Kaiser system. And I've never heard anybody complain about the Kaiser Senior Advantage plan. I've heard plenty of comments, negative comments about Advantage plans that people end up getting into because somebody tells them, oh, it's going to cost you less money, but then they find out that they get less coverage and more out of pocket. So then we were going to get into some terminology, but does anybody have any questions that they want to ask us about Medicare?
Can you make changes once decided at a certain Y in the road? Can you make changes, let's say 1, 2, or more years later?
No. Once you choose, especially if you go to an Advantage plan, there is no going back to go to the original Medicare.
Thank you.
Anything else?
Mary, it seems to me when I watch TV commercials that the Medicare Advantage plans are pushed pretty hard and oversold. Is that perception true?
It can be, and there are plenty of healthcare brokers out there, and I'd like to believe that they're all really watching out for the people that they're working with. Medical brokers are not paid by the client, they're paid by the insurance companies. So that can cause a conflict of interest when somebody is trying to get information about which direction to choose when it comes to Medicare. So you do have to be careful about that. And, you know, if you think about it, the reason why we're seeing advertisements out there for Advantage plans is because they have the advertising budget to do it. The government is spending the money on the actual medical care and not on advertising. So it is pretty easy to end up in an Advantage plan and not understanding all of the negative aspects of going to an Advantage plan. But once you're in one, you've got to make it work for yourself, because there isn't any choice to go back over to original.
If I could just add, my elderly father who lives in Michigan had a retirement, a retiree plan with Aetna, but at his, age and watched a lot of television, they advertised so heavily. He was influenced by a lot of the inclusions, the vision, the dental, all of that they advertised for, and he did get hooked into it. We didn't know it at the time, and we had to unravel that. We were able to, but it was not a fun process, and he was so taken advantage of. It makes me upset that they do that they advertise so heavily, and that mistakes like that can happen.
Yeah, they can. and very easily. It's there are so many aspects of what our senior community goes through where they can be easily taken advantage of, because this is not simple stuff, right? And when you're a senior person and you're living on your Social Security, of course you're going to be looking for low cost solutions because Social Security usually doesn't cover everything for you. So I'm sorry that that happened to your father.
Yeah, but yeah, beware. That's why I asked the question. Be a little wary about Medicare Advantage. Mary's right about the Kaiser Senior Advantage, but be careful about it.
Yeah.
I do want to answer the question that Mary put into the chat, where she asked a question about the PPO.
Mhm.
And the question was, talk about the relative size of the network for each of the different plans. So each PPO has different sizes of networks. So for example, I think I'm on a Anthem Blue Cross PPO.
Mhm.
And the with the PPO, what you need to ask, and I think you're going to hear this theme from me and Mary throughout this, is you really need to ask questions. As a consumer, if we go to a store to buy a jacket or groceries, we know the price. But when people go in for medical care, we never ask about the price, and you really have to, and especially with some of these recommendations. And so on my PPO, I went to the dermatologist, and she took something off my forehead and sent it to her lab, and she chose the UC San Francisco lab because UC San Francisco is an amazing hospital. And then I got the bill for it and I realized it was hundreds of dollars for this lab test. And I asked her, why was this so expensive? Oh, it's not in your network. But if I would have used the network lab, it would have been, $35. So yes, your PPO can have, a handful of choices in network, and you might have a specialist who's out of network, but just find out, is it in or out, and whether it's going to cost, substantially more.
Mhm.
But the sizes, that's going to be a plan specific question. But it's good to check. It's good to check before you go for a treatment or, any sort of specialist if it's in or out of network. Mary Ballin, would you add anything to that?
Well, the only
Question.
other thing I'd add to it is, yeah, the PPOs can be pretty complicated, especially when you're going through like an open enrollment with your employer, because they offer different levels. And a lot of times people will just pick the one with the lowest deductible, but it's going to have the highest premium. So trying to get an idea of how much and how often you go to the doctor can be really important. And again, to Eric's point, asking questions. If you have the ability to change plans or you have to change plans for some reason, make sure you're calling your doctor and asking them if they participate in whatever the options that you have for your open enrollment, because they might be in network for some of it and they might be out of network for others. PPOs will allow you to go in network or out of network, but you're always going to pay more for anything that's out of network. And it's a shame that Eric had that experience with his dermatologist, because it would be nice if the doctors would say, I'm going to send this out to X lab. Is that part of your in-network program, or is that going to be out of network? And I guarantee Eric may not have known that off the top of his head, but it's an easy question to get answered. And normally in doctors' offices, there's somebody that's designated to handle insurance questions, and they can make that phone call to make sure that someone, that an entity is in network versus out of network. I really do think it's unfair when people get blindsided by huge bills of any sort, medical or otherwise.
All right. Any other questions before we go on to terminology?
I have
Angela?
another
Oh,
question.
Angela, did you find out what kind of?
I did find out. I'm surprised it says it's an HMO, which
Okay.
I didn't even know that. But my question, now that I have that one answered, if I choose to see a doctor and I know that doctor is out of network, does my insurance, is there part of my insurance that could cover any of that, or just because they're out of network, they won't cover any of it?
Yeah, a lot of times they won't cover it if the doctor is out of network. So you might want to call your insurance company and have that conversation with them. Traditionally, that is the case though, but I don't want to say absolutely positively because I don't know everyone, but traditionally HMOs say you have to use the doctors that we approve.
Okay. Thank you.
Yeah, no problem. I'm glad you're able to find out that you have an HMO.
Right.
Any other questions? Okay.
Mary,
So I'm
sorry,
gonna
I
go
was coming off
through.
of, I was coming
ahead,
up with
Libby.
mute. Sorry for the delay. I just want
No.
to make sure we answer Mary and Linda's questions.
Is that the
We're
appeals?
gonna come back
Yep.
to Linda. Yeah, here, we're gonna get to Linda here in a
Okay.
second. We got Mary. Yep. Mary
Okay.
Ballin, will you go to the first terminology slide for us?
Yep.
So we've talked about a few of these, but premium obviously, and some of these are basic. Premium is the amount of money that you pay on a monthly basis for your health insurance. Some companies pay all of it for you. Sometimes it's shared. The deductible is really important. That's how much you have to pay during a 1-year period for your covered healthcare services before the insurance policy will come in and pay the rest. So if you have a $2,000 deductible, you pay the first $2,000 and then they will pay some on top of that. The other two that we already talked about are in-network and out-of-network. So if you are in a PPO and there are in-network providers that are approved by your PPO, the charges are going to be negotiated and they're going to be less or included in your insurance. And if you choose a doctor that's not in the network, then the cost to you is going to be higher. Mary, let's go on to those are pretty basic, but does anyone have questions on those? If not, we'll go on to the next slide, which is co-payment and co-insurance.
Yeah, and Eric, did you want to take these? Because these can be confusing.
Yeah, go ahead. I'll let you do it because I always get confused on co-insurance. So this is where I get tripped up. So co-payment.
So co-payment is pretty straightforward. You go into the medical office to see your doctor, and there's like a $45 charge that you have to pay. And that's just because you showed up in the office. So that's what a co-payment is about. And there usually is one co-payment for your kind of primary doctor, and then there is a different co-payment in a lot of cases for specialists. I know on my policy, it's like $35 if I go in to see my general doctor, but if I want to go see the dermatologist or something like that, I'm going to pay $85 as my co-payment. So that's pretty easy, pretty straightforward. Co-insurance is a little different, and I don't know why they have to give it a name that's so close to the other, but co-insurance is you've got a deductible, you've hit your deductible, and then your insurance policy says, we'll pay X percentage of the rest of it. Okay. That's where co-insurance comes in. It's your share of that additional medical cost. So trying to keep the numbers really simple here, you have $1,000 deductible, you're going to pay that $1,000 for the deductible. And then you get a medical bill for $1,000. And your insurance says, we'll pay 25% of the next step in your medical insurance. Well, that means they're going to pay $250 of that second $1,000, and you're going to pay $750. So understanding how much you're going to have out of pocket is pretty important. Does that make sense to everybody? Yeah, and as the slide says here, it's different for in-network and out-of-network. Usually, they will pay for co-insurance a higher percentage for in-network facilities and doctors versus out-of-network facilities or doctors. So if I choose to go to a doctor that's out of network, I'll pay my deductible plus whatever the co-insurance is, and it might be a much let's say an in-network doctor, maybe they'll pay 50%, and an out-of-network doctor, they'll only pay 25%. Clear as mud?
So a question on that.
Yes.
Let's see. So if I understand it, so deductible is sort of a ceiling that you meet in the first level. Say you mentioned $1,000. You've had care that would accumulate to that $1,000,
Yes.
and boom, your deductible is met. Then there's sort of the second tier where it's like, okay, well, we will share these expenses going forward, 20%, 80%, or whatever it might be.
Mhm.
And then my understanding is you would reach another sort of ceiling. Are those the deductible and the co-insurance would go toward meeting your out-of-pocket maximum?
That is correct. And that's good that you brought that up, because yes, on every policy I've ever seen, there's a maximum out of pocket that you will pay. And so you're exactly right. You're going to pay your deductible, that's out of pocket. And then your portion of all the co-insurance is out of pocket. The other thing about a lot of medical insurances that are out there now is preventative care is usually covered 100%. So there's no out of pocket for that. There's no deductible for that. And so, they encourage all of us to go and make sure we're getting our annual physicals and checkups and that sort of thing. So, but you're exactly right. There is always going to be a maximum out of pocket. And then there's also going to be a lifetime, there's an annual out of pocket, and then there's a lifetime coverage as well.
So
Does that make
if
sense?
it does make sense, at least from what I'm hearing. Another question though, on that maximum that you might pay annually, is it dependent on the plan that you have, or if one member in your family, because in my case, I hold the insurance, but I am insuring my husband and 2 dependents. My husband is the one that is accruing some, rather large bills with his treatments. And he's the one that's reaching not only the deductible first, but the co-insurance and everything going toward the maximum, the out-of-pocket maximum. So if one person in your coverage meets that, then does that mean that perhaps, for example, I would not have to continue to meet my own deductible, my own separate deductible, if we have a family out-of-pocket that is met?
Yeah, so you'll want to check into your policy. There normally is an individual out of pocket and a family out of pocket. So in what I have found, at least with my own insurance, is that the family out of pocket is equal to 2 times an individual out of pocket. So for, mom and dad and 2 kids, if 2 people meet the deductible for themselves, that will cover the rest of the family when it comes to deductibles.
Mary, will you go forward to slide 21? We've got an example of this.
I bet there's an easier way to get to 21 than what I'm doing.
Yeah, there you
But
go. That one,
sorry.
back one.
There you go.
Perfect. So so to your question, Linda, on this one, on the left side under where it's blue, it says plan deductible individual. So you can see the example is $1,000 for in-network deductible, and then below that it says family is $3,000, and then below the deductible, the second blue box is out of pocket maximum. For the individual, it's $8,200, and for the family, it's double that, $16,400. And then it shows the amount applied to date. So yeah, you might have your individual out of pocket covered, but not the family. So in this case, the family one shows minus 9,000, but they haven't, so if one person was covering their individual, but you haven't hit the family, that might be in the situation where you're in. And then interestingly, over on the right, on the far right columns are the out-of-pocket networks and deductibles, or out-of-network deductibles and out-of-pocket maximums as well. So that's Anthem's way of showing it, for what that's worth.
Yeah. Does that help clarify?
Yes, it does. Thank you. It's fairly complex, and my plan, of course, has different numbers. but I will
Yeah,
go
of
back and look
course.
at that. What I had trouble with last year, 2023, was determining when those dates were met. And that was where we disagreed, the insurance company and myself. But that's a grueling process to go through claiming.
Yeah,
Right.
it definitely is. And I'm sorry that you had to go through that, because it's the last thing you want to do when you're dealing with a family member with a serious illness like cancer. All right, are we going backwards now, Eric, or
Sure. Well, let's see. We were back on
where were we?
terminology.
Oh, we are still in terminology. Yeah.
But slide 15 was actually out-of-pocket network was coming up. There you go. There you go.
Okay, there we go. So a couple more terms. Balance billing just means it's the balance that's due to you, but it's the difference between the total bill and the allowed amount that is there, and it happens most of the time when you're dealing with an out-of-network or an as it says here, non-preferred provider. So sometimes you'll pay, I know this happens to me when I go to one of my specialists, I'll pay them a co-payment, and then I get a bill later and there's still additional money that's owed. That's what the balance billing is the amount that the doctor is allowed to bill you for that doesn't get covered initially. I mean, most doctors are contracted with the insurance companies and they can only bill certain amounts. So as long as they're staying within the agreed amounts for whatever the procedure is, you may have to come up with a differential. I think we touched on out-of-pocket limit. And the important part is once you meet that out-of-pocket maximum, that's when the insurance company will cover 100% of the charges, as long as you haven't met the lifetime charges. Again, this is really complicated, and I didn't see who was talking, but the person who has been fighting with insurance companies probably knows all too well how complicated it can get with the insurance companies.
And if I can just add one comment on that, Mary, I mean, the reality is if you go into the hospital and have a surgery, the bill's going to be 40 or 50,000. You're going to, you have one good surgery, you're going to hit your out-of-pocket limits pretty quickly.
Yeah.
I know in my situation, once I hit that out-of-pocket limit, the rest of the year, things got simpler. So at some point once you hit that magic number, it gets a lot easier.
Yeah. And under certain circumstances, you can get to those maximums pretty quickly. So now we're going to get into abbreviation and acronyms. And we included this in here because we live in a world of abbreviations and acronyms, and every industry has them. I know Eric and I can talk acronyms to each other that are for the financial industry all day long, and somebody standing next to us would think we were speaking Greek to them. So I wanted to purposely touch on some of the acronyms and abbreviations, just so you would have them. And if you want a copy of this PowerPoint, we're more than happy to send it out to you. But some of the basic ones, like EOB. EOB is your explanation of benefits. You get those in the mail, and you can match them up with your receipts so that you know exactly what your insurance company paid and exactly what you're going to have to pay out of pocket. FMLA is another pretty common one, family medical leave. HIPAA, everybody has to sign those HIPAA forms. So that's health insurance portability and accountability. And it was an act that was passed in 1996. And then LOS, length of stay, COB, coordination benefits. I mean, it goes on and on. OOP is another one that you'll see all the time, out of pocket. PCP, primary care physician. So, you know, the acronyms will go on and on and on and on. And again, if you want a copy of this, just so you have them as a cheat sheet, I'm sure Libby can give it to you, or we can send it to you, either way. Then there's the prescription drugs, which is also another, can be very complicated, especially since there's tiers of medications. And when you're getting into the specialized medications, especially probably with cancer treatment, you're going to be hitting on some of the higher tier medications pretty easily. Again, you're going to need to read your policy to figure out how your insurance covers the prescription drugs that you need to take. You know, and because of, I mean, obviously what prescription drugs can do, it is regulated by our government. They don't want anybody getting a hold of certain medications. So the formulary levels is what I was just touching on, the tiers, tier groups of different medications. And it will dictate the cost that you'll pay or that the insurance company will cover. The higher the tier, the more expensive it will be. I know, and this has nothing to do with cancer, but one of the big ones out there that you see just a plethora of advertisements about is Ozempic. Ozempic is a tier 4 medication, and it costs individuals hundreds of dollars every month to be on an Ozempic drug, on the Ozempic drug, because it is a tier 4 medication. And then there's the specialty medications that take special handling. I don't know if any of you have ever had experience taking any sort of narcotic type of drug. Painkillers is one of them that comes up. Those take special handling, and the pharmaceuticals, those pharmacies will be very careful about how they administer those out to individuals. Any other questions here about prescription drugs? It all comes back to that slide very early on. Again, the devil's in the details, and unfortunately, it's something that having an advocate to help you get through it is going to be pretty important.
I think there were some questions in the chat about appeals on drugs and things like that. Are we gonna, when will we talk about that? I'm curious about that myself.
Sure. So appeals is when you don't agree with your insurance company, and those are not easy. I know when I've had an insurance situation where I was told, nope, we're not going to cover that, they usually come back with alternatives. And I don't know if that was the experience. And if they give you alternatives, the best thing and the easiest thing to do is to go back to your doctor and tell your doctor about what's going on, so that they can either, one, say, all right, let's try this other medication that they're offering that they will cover, or they're going to have to help go to bat for you too, because they're going to need to write up and go through whatever the appeals process is. And it's usually a matter of the doctor filling out forms and explanation as to why they feel the patient needs the specific drug that's being prescribed. It is really unfortunate that the insurance companies are the ones who are dictating our medical coverage, and not just allowing doctors to do what the doctors are supposed to do best and prescribe the right procedures and medications for us. But I know it can be very difficult to get an appeal approved. Perseverance does pay off. So, but go back to the insurance company and say, okay, if you're not going to approve this, what will you approve? And then I'll go back to my doctor and I'll have a conversation with them about it. Does that help?
Yeah, I don't want to get into any details, but in my situation, it was a drug that they had approved last year, but then come January, they said, nope, we're not gonna approve that drug anymore.
That's because the tier systems are changing all the time. And for whatever reason, the insurance company decided that that specific drug, whatever it was, wasn't going to be on the tier that it was on last year. It's on this new tier system, and it's going to take extra, hoops and mountains to climb over for you to be able to get it. So
And I
again,
am working with my doctor and the
Yeah.
insurance company, and I just appreciate any ideas you might have, so thank you.
I wish I had a magic wand for you. I just know, and I haven't dealt personally with any dealing with cancer drugs or anything like that, but I have had to deal with, oh my God, my doctor said this was the medication I'm supposed to take, so why are they not approving it? And I had to go back to the doctor and tell the doctor, and the doctor rolled their eyes, and they didn't really roll their eyes, but I'd rolled my eyes. And then the doctor's office actually did the heavy lifting for me. They had to go through whatever the doctor wrote up as to why they were prescribing this specific medication for me. And they had to submit that and follow the rules the insurance company gave them very closely. Because, if you miss dotting an I or crossing a T on those appeals, they're going to kick it out again. So, making sure that you've got somebody that's very detail oriented going through that appeals process to make sure they're hitting on everything that the insurance company is requiring is going to be super important, or you're going to keep going around and around and around in circles. So, and you can even get a copy of whatever the appeals process is so that you can double check the work of the medical office that you're working with.
Thank you.
Any other questions? I'm sorry you're going through that. That's miserable. Any
You've
other
got a
questions, Mary?
section on other common problems, right? That's coming up. I'm looking forward to.
So what other common problems are you thinking about?
Well, I'm curious about navigating supplemental plans as well as basic plans, and that I don't know if others are or not, but
Okay. And are you talking about through Medicare?
yes.
Okay. So once you have chosen to go down, are you talking about a Medicare original plan or a Medicare
Yes,
Advantage
Medicare
plan?
original, yeah.
The original plan. And do you mind sharing basically what issue you're having? Because the one thing that's nice about the original is that you can go to any doctor or any facility that takes Medicare across the country. It doesn't matter what state you're in. You don't have to worry about it. You just have to get with that facility. Now, but you're talking about prescription drugs, correct?
No, not just
Oh, okay.
prescription drugs. I mean, in
Okay.
addition to Medicare, I pay, I've had a couple of dances with cancer and some other serious health things. And
I'm sorry.
so I pay for a supplemental plan that's another
Mhm.
chunk of money every month. I pay for a vision plan. I pay for a prescription one beyond what Medicare covers.
Hmm.
And every year it's a judgment call to try and evaluate whether it's worth my while to be doing those, because they all carry their individual separate co-pays or premiums, deductibles, etc. And
So it really would depend on if you're using them. Okay. And even when you're employed and you're not on Medicare, every year at open enrollment, you get this choice of the different plans that you can take. And I think it's really important to sit down and say, what sort of medical visits did I have this year? What sort of medical procedures did I have this year? And what aspect of my insurance was used or not used? So if you're using your supplemental plan and there's a reason, and I can't come up with anything specific, but we know what Part A is going to cover. We know what Part B is going to cover. We know what Part D will help cover because it doesn't cover all the medications.
Right.
The supplemental plan is supposed to help with the Part D donut hole. So, hopefully that plugs that hole up. But then it comes down to, okay, what did I experience this last year that wouldn't have been covered by A, B, or D? because that's where the supplemental plan comes in. And if you're experiencing situations where your supplemental plan is not working, it's not doing anything for you, then there's no reason to be paying for it.
Yeah. It's a little hard to evaluate that because typically, I mean, they cover the copays for pretty much anything, any doctor, any physical therapy I go to or whatever. So,
Mhm. Well, I think does that help answer your question though?
yeah,
Because otherwise you'd have all of those out of pocket, since there are deductibles that have to be met for even Medicare. But that is what the supplemental plans are there for.
Yeah.
You know, unfortunately, I don't understand why Medicare, and God knows I'm just one person, right? If I was running the world, haha. But you know, why doesn't Medicare cover visual? Why do people have to, you know, go out of pocket 100%? But there are, you know, insurance plans out there that are fairly cost efficient when it comes to vision. But dental's the other one. Medicare doesn't touch dental, and dental becomes completely out of pocket. And God knows dental procedures are very expensive. And as we age, you know, dental hygiene can really help us to stay healthy.
Yeah.
So it's frustrating.
Another issue that I don't know if it's relevant to others. I saw one comment in there about living overseas, but travel and medical insurance for travel. You know?
Yeah. Medicare does not cover people outside the United States. It will medevac you back to the United States, but it will not cover you for medical outside the United States. You actually have to buy a specialized plan if you're planning on going outside the United States and being there for a long period of time.
So Mary, one of the questions that somebody asked is they're going to spend part of the year in Northern California and part of the year in Portugal. We're currently assuming that we can do that. Is that a correct assumption? So anyway, the idea would be to have local affordable insurance in Portugal.
Right, because Medicare is not going to cover, do the basic coverages if you're in Portugal. And it's not an emergency situation, because again, emergencies, they're going to help medevac you out and that will be paid for, but they're not going to pay if you get, you know, an ear infection or a UTI or something like that in a foreign country. You're going to have to pay out of pocket.
And then the other question in the chat, Mary, was how do covered California plans compare to private insurance plans?
Yeah.
And the comment is, I understand the premiums are subsidized, but are deductibles and copays comparable?
Yeah, I mean, I actually have for myself, I don't know if you do, Eric, but because I am self-employed, I am on a covered California plan. Now, I don't get any subsidies because I make too much income. And the subsidies come in dependent on people's income limits. You know, but I find that my Blue Shield plan that I have is pretty comparable to what I had when I was an employee with a large firm, in a different chapter in my life. I think the employer-sponsored plans have a tendency to be a little bit more Cadillac plans than the covered California, but I don't think, you know, the covered California plans are bad plans. You just, again, need to look at them, think about what sort of coverages you need. And obviously we don't know everything that's going to happen to us in the future. So you go off of what you know and you pick a plan that works best for you. I can see all the same doctors that I've been seeing for years and years and years. I have, you know, a deductible, I have copays. So everything is pretty similar to what I experienced when I was in an employer plan. It's just under the Covered California program, and Covered California is not just for low income people. It's just subsidized for people that have lower income.
So Mary, why don't we do a couple of the basic tips and then see if there's any questions left? How's that sound?
Sure, that sounds great. I don't even have a clock in front of me, so I don't even know what time it is. We're at 55 minutes. Oh my goodness. All right, so
So-
I think the most important
so I
thing,
was
do you want to
gonna do
cover
this
this,
one,
Eric?
Mary.
Go for it. Yeah, phew, thank you.
Give you a
Water.
rest.
Thank
So
you.
these are simple tips, and I think Libby and the cancer support community have some tools and resources around this as well. But obviously, we want you to stay organized. And number one is don't let your health insurance lapse. So make sure your premiums are getting paid. Whatever you need to do, make sure those are up to date and current. Down at the last bullets is that to get help from a trusted friend or family member. So if you're struggling to stay on top of this and want someone to help you, this is a great way to help stay organized. On the next slide, there's a little picture of a file box, and we certainly recommend that if you find file folders are best, or binders, whatever works for you. Start throwing everything into a box or a folder or something. And like we talked about earlier, you're going to start getting all these copies of EOBs and medical bills and receipts and things like that. If somebody can organize them into folders for you or put them in a binder, that's great. We find that is really the key to staying on top of things. And then at some point, hopefully once you hit your out-of-pocket limit, you don't have to worry about these things, but until you get there, it's good to keep track of everything.
And the other thing I that I saw when my sister was going through cancer treatments, her husband was her advocate and would go into every single doctor's appointment with her, and he was the note taker. I mean, I'm sure it's very overwhelming to be the patient sitting there listening to your doctor tell you about everything that's going on and what they're thinking and what your treatment needs to be. And it's hard to keep that all straight. So having somebody that can take really good notes so that you can go back and you can read through them, or even ask the doctor if you can record the conversation. You do need to ask if you're going to record somebody, but I think it's really helpful so that you as the patient can go back and listen to what the doctor's saying at a second or third or fourth, fifth time if you need to, just so you can keep in mind everything that they've said to you.
Great. So Mary, I know we want to keep track of the time.
Yeah, we're at 58 minutes, so we must be hitting, oh, there it is, 5:02. We are at 5 o'clock. Are there any last?
Let's open up to questions.
Yeah.
You want to raise your
Victoria,
hand or shout it out?
Victoria, I see you with your hand up, patiently waiting.
Yeah, I was concerned about switching plans. Is there any prohibition if I try to switch, say, from Kaiser to UCSF, that they will cite that I have a pre-existing condition, or can you be pretty mobile between plans?
I know that there's rules now that you can't be denied insurance, but that doesn't mean that they can't make it astronomically more expensive for you. So just make sure you get all the details out of what it will pertain. And you do normally have to be, I mean, are you on a company plan, or are you on Medicare? What level of insurance?
I'm covered because I was a state of California employee.
Mm-hmm.
So I'm covered at Kaiser.
Okay.
But I'm thinking I might want to switch to UCSF.
There may be an open enrollment period that you need. Yeah. So normally for open enrollments, you can switch. You just need to find out if they're going to charge you extra because you do have pre-existing condition.
Okay. Thank you.
Okay. Mm-hmm.
Mary, I know you had a hand.
Slide up too.
I'm sorry, what are you saying?
We put the very last slide up with our email addresses on it.
Yeah, I was trying to figure out how to jump there, but I think the fastest way to jump there is just flip through all these things.
All right. What were you saying, Libby?
Mary, the other Mary in the chat, I know you had a handful of questions. Just want to make sure we got at least a couple of them answered. So if you have a dying question.
Thank
go
you,
ahead,
Libby.
come off mute.
Thank you. I think the biggest question is, it just feels like there's so little transparency in pricing. I feel like I'm taking a leap of faith every time I go to the doctor, and oftentimes with sticker shock after the fact. And I was just wondering if there's any tips on becoming more savvy on, without having to call the insurance company for every little procedure that I have to have done.
Yeah, no, I understand. I agree with you. I think medical insurance is one of the least transparent insurances that are out there, and that's not saying much. But understanding the difference between something that is considered well care, like, because those are normally pretty well covered, and then everything else. So everything else, I mean, different procedures, that's why they have certain medical numbers that they put on none of us are going to understand any of those numbers that you put on there, although you can look up the procedure numbers that are on your medical bills. If you Google those numbers, it'll come up and tell you what the procedure is, and then you can talk to your insurance company. But unfortunately, if you agree to a procedure and you have a certain coverage, you can't negotiate the cost of what the insurance company is going to charge. The insurance company's already done negotiations with the medical practices, and sometimes it's group practices. And the doctor can only charge you what's the agreed upon price, and whether or not you have a copay or co-insurance, it's just the way the math is going to work out.
Mary, I think the questions that I would make sure you ask is, one, is this in network or out of network? Number two, is this test necessary? Because, I know a lot of times, doctors just say, well, let's test you for this, this, and this. But if you're paying for it, you can say, is this test absolutely necessary? Because I'm gonna have to pay for it. And then the third is you can just ask how much it costs. Like, obviously, if you're going to the dentist and you want to know how much is the exam or the x-ray or, a filling, they'll tell you. If you go to a dermatologist, they'll tell you how much an appointment is. They're not going to tell you, like, if you're going in for, a certain procedure and you're going to need anesthesia and lab tests, they're not going to be able to tell you all the pricing on that. But on some of the smaller procedures, you can definitely ask, how much is this going to cost? And, do I have any choices? So those are the three questions I'd make sure you ask.
Thank you. That's very helpful.
So I see everyone mentioning in the chat that they would like the presentation and the slides, which is A-okayed by Mary and Eric. So we'll be sure to get that out to all of you since you registered. And thank you all for being a part of today. And a big thanks to Mary and Eric. These presentations are presented by Mary, Eric, and Chad, who was unable to be here today, every other month. It's like drinking water from a watering hose, right? It's a lot of information to present and to learn. So every other month, we will have this same topic as well as an estate planning topic. So the next presentation that can be found in our program as well as online is going to be June 4th, estate planning when it's only you. And we're gonna look at changing that topic a little bit, or the title of that, but it's on estate planning on June 4th. So I'll be sure to get everything out to you. Thanks so much, Mary and Eric, and have a great night to all of you.
Yeah,
Good
thank
night,
you very
everybody.
much. Thanks.
Many
Thank you,
thanks.
Thank
everyone.
you.